to put myself in the confidential space between the patient and the physician here, but what I would do is, if I put myself in your shoes for a minute, to think about if I were worried about my children or grandchildren at any point in time, I would talk to the physician and tell them this is the history residentially, this is where we've lived, and these are some of the things that are happening, everything that you've heard here today. Yes, physicians don't often have more than 15 minutes per patient, so write the major concerns down so it doesn't become a rambling conversation, but get across the points about cancer concerns and the different cases of cancers that we've talked about today. Neighbors, friends, relatives, and so forth. Tell them where you live, tell them where the grandchildren play, and then let them arrive at an objective clinical decision.
My name is Mary Osco. I am a stage 4 non-small cell adenocarcinoma lung cancer patient. I am dying. I hear the beeping bells as they back up with load after load of contaminated soil taking it out of my neighborhood. I had two things and purposes to walk up to this mic tonight. I want to stand here and represent those who can't speak anymore. And soon that will be me. I have an 11-month-old grandson that will not know his Nana. I raised 2 children in the neighborhood because we thought we had a choice of 2 houses to buy in the family. It would be a healthy, great place to raise kids. Push them outside, make them play in the park. I used to walk 24 laps a night around that park, thinking that I would gain great health, not tumors. I was diagnosed 2 days before I was to become a registered nurse late in life, 18 months ago. I was at the top of my class. I excelled. I rocked nursing. I was phenomenal at the bedside. I touched my patients, and there wasn't a body fluid that bothered me. 2 weeks after I was diagnosed, 2 weeks before, I was doing my precepting on the floor, the ICU step-down unit, Heart Hospital at Mercy. I would be a patient there. Chest tubes, oxygen, epidurals. It wasn't a body cavity that didn't have something coming out of it. And I still have pain from that surgery. They closed me up, and I walked out to my husband, and they told him that I am inoperable. But guess what? Cancer didn't win. I scheduled my test without anybody knowing, and I drove to the testing center, and I rocked that NCLEX. And today, I am a nurse. But I will never practice bedside. Instead, I will soon be deciding which hospice agency to use. I would like to die at home, but I really don't want to drive hearing trucks going up and down our street from the beep, beep, beep of the truck as it leaves with contaminated soil. So my question, Dr. Khan, is I do know some things because I wanted to go into medical research. I was told at nursing school that I had a problem taking tests at the beginning because I went too much down to the cellular level, and nurses didn't do that. But I can tell you all about protein expressions. And when they told me that I had adenocarcinoma, I knew my fate. I have the EGFR mutation on my exon 21. It's usually found in Asian non-smoking women. So I am on an oral agent that on average holds things at bay for about 15 months, and I'm at month 18. About a month ago, I was told that I have new growth. I always say that they shoved me into the great white tube, and that would be the CT scan or the PET scan tube. Multi-million dollar machines It's not that fun to get shoved in there. And I've been told that I have growth again on my pleural wall. So I will look at laying face down on the table and having a needle plunged into my back and into my lung to take a biopsy. And they will gene sequence it to see if I mutate into a new expression. And hopefully I can get into a clinical trial and my life can be extended by a few more months or years. And I honestly question whether I want them to do that. Because you see, as we sat here tonight, my fingernails split. My skin started splitting open and I can feel my heartbeat through that. Every beat of my heart is pulsating through my finger. Where my bra is, my skin gets rubbed off. My hair is falling out. My eyelashes grow incredibly long. Try to wear a pair of glasses to see when you have giraffe glasses. So some of us tweeze our eyelashes, or we cut them. Our feet get infected. It's hard to go out in the sun, I burn immediately. There's a plethora of side effects just to try to sedate alive. I am a patient down at Siteman, and I feel very grateful to have one of the best institutions to be treated at in the country. I'm being seen by a leading thoracic research oncologist, and I'm grateful that 7 days a week, Dr. Govenden gives his life researching, treating his patients. But yet, so many on my healthcare team have no idea what I am talking about when I state that I have been exposed to radioactive waste in the North County area. Had that been so, I could have been diagnosed almost a year sooner. And maybe my stage 1, that has a less than 17% chance of giving me 5 years of life, could have been caught maybe at stage 1 and I would have had an 80 to 90% chance of living. So when you say a goal is to educate our doctors, and you're talking to our doctors and yet they don't know, and I'm being told, well, there's not really data, and everything is about evidence-based research and evidence-based practice. What are we to do to get them? It doesn't have to be written down in black ink. Look at us. Do screenings. Do you know that a lung cancer screening would have cost a whole lot less? I take $6,000 to $7,000 worth of medication a month to stay alive. One lung cancer screening a lot earlier maybe would have caught it, and if I would have had a lobectomy, it could be done. If I happen to live another 3 or 4 years, do you know what that's going to cost to keep me alive? A lot of money. And don't get me started on what my home value is. My primary care doctor last visit, why don't you just move? He said, why don't you just buy my house? How can you put a sign in the front yard of any property that borders near this toxic waste and expect anyone to want to come in and bring their family? My husband and I would have never exposed the 2 most beautiful children in the world to this had we known. My daughter experienced a miscarriage. My daughter experienced an infertility. And I was told that I may have had this in my body as long as 20, 25 years. 22 years ago, I gave birth to our son. Was I pregnant and carrying him and had this already growing? These crazy thoughts go in your mind. What have I done to my kids? I have a hard time looking at them. I have very little monetarily to leave my children. I wanted to leave them with memories, and I wanted to leave them with good health. We're trying to pack all we can in every chance we get. And I don't know about the health part. do something to make our healthcare providers know that we want to be screened early, we want to be taken seriously. I am the face of cancer. Everybody tells me I look pretty healthy, but you haven't walked in my shoes. I would not wish my disease process on ISIS members. I wouldn't.
I charge that we forever remember that name. And when you ask me, why do I do this? I will say Mary Oscar.
You just save lives. You just save lives.
We have to make this work. We have to do this process. We have to encourage our elected officials and demand that they clean this up. There is no alternative.
It's in the soil.
It's in the soil,
Soil.
and it got moved around, and it's everywhere in North County, and we have to stop it. We have to stop it this generation. And the only entity on the planet fixing that is FUSRAP.
That's right.